Hi everyone, this video is going to demonstrate how to transfer instruments to your operator. I'm not working with an operator, as you can tell here. I just have a mock-up of a glove. We're mid-COVID, so I don't have a partner to work with, but we'll still be able to do the demonstration because when we're transferring instruments, the doctor really only signals that they're ready for a new instrument. They don't reach for the item, they don't grab for it. They're waiting to feel the instrument hit their hand. Their focus is on the tooth that they're working on. And it's our job as an assistant to get the instrument into the doctor's hand. First, some guidelines on transferring instruments. When we transfer instruments, we want the working end that's going to be used directed towards the mouth. We also want to keep the instrument parallel to the floor. We don't want to have the instrument droop or lean to one side. We want it parallel to the floor. Our grasp, the assistant's grasp, has to be on the instrument anywhere other than where the doctor has to hold the instrument. So we have to think about how will the doctor hold it? And that will tell us that we can hold it anywhere else besides that area. So for most dental instruments, these single-handed instruments like this, we're going to hold it away from the working end in a pen grasp. So we hold it between our thumb and index finger and we support it with our middle finger. That leaves our other two fingers free to retrieve old instruments from the doctor's hand. When you deliver instruments, deliver them firmly into the operator's hand so they can feel it. Remember, they're not watching, they're waiting to feel it. Another guideline to remember is to direct the working end towards the arch that's being worked on. So if you're working with, we've got a ball burnisher here. If you're working on maxillary, make sure your ball burnisher is pointed upwards. So the doctor, all they have to do is grasp that instrument and go directly into the mouth, and it's already in the direction of use. If you're working on mandibular, the ball burnisher should be pointed downwards. Again, so when the doctor goes into the mouth, the instrument is already facing the proper direction. So those are some guidelines to keep in mind for all of these instrument transfers. Hold the instrument opposite of where the doctor will hold it. Most of your instruments are going to be transferred parallel to the floor in the direction of use, facing the oral cavity. Another thing to remember is never pass over the patient's face. You don't want to deliver instruments over the patient in case we were to drop them. Always transfer over the patient's chest. So the first items we're going to transfer, I'm going to get them in order here. We're going to start out with the Mirror and Explorer. When you hold the Mirror and Explorer, we deliver them both at the same time to the doctor. We need to hold the Explorer in our left hand. We transfer the majority of instruments with our left hand. The mirror we will hold in our right hand. Since we're sitting opposite the doctor, our left hand delivers into their right hand. Our right hand will deliver into their left hand, their non-dominant hand. So this demonstration is specifically for right-handed operators. Everything would be reversed for a left-handed operator. So we are going to deliver these at the same time into the doctor's hands simultaneously. Again, this is for efficiency. We don't want the doctor to wait, here's your Explorer, but wait a couple seconds till I get the mirror. Logical and efficiency states deliver both at the same time. And you can remove them both at the same time. Oftentimes the doctor keeps the mouth mirror because they need to continue to use it throughout a procedure. For our demonstration, we're going to pretend we're working on tooth number 8. So every item I deliver into the doctor's hand should be directed towards tooth number 8. So the doctor is still working with the explorer. Sometimes the doctor will call out what they need. Most of the time the assistant knows what they need next, just due to familiarity. Working with the doctor frequently, we get to know what they expect next. And most procedures have a logical sequence. So my doctor called out for the air water syringe. Now they do have one on their side, but sometimes they would like it delivered to them. So let's think about the air water syringe. Think about where the doctor has to hold it. They need to hold it in the palm of their hand so their thumbs can press the buttons here. So if they're going to cover the instrument like so, that only leaves the tip for me as an assistant to hold on to deliver it. We don't want our fingers to touch, our hands to bump, because that could lead to us dropping the instrument. So we're working on tooth number 8. This nozzle, I can rotate it upwards or downwards based on the arch. Since we are maxillary, let's face that upwards. Be careful not to twist this part, this adapter part, because you could loosen the mechanism. But you can twist the nozzle, the tip. This one, because I have to hold the nozzle, I'm going to hold this one with my right hand. That leaves my left hand free to pick up the old instrument and deliver this firmly into the doctor's hand. And they would, of course, use it in the mouth. To remove the air water syringe, so their hands are grasped, their fingers are grasped around the air water syringe. The only place for me to grab the instrument to remove it from their hand, again, is the tip. Now, a general rule of thumb, another guideline, is before you take something away from the doctor, you should have something to give them. The goal is efficiency. We don't want any downtime. If I take the syringe away and the doctor has to wait another 10 seconds for me to deliver the next instrument, we've just wasted 10 minutes that could be used working on the patient. So I'm going to deliver the explorer back. I'm going to take the air water syringe with my right hand and deliver the explorer with my left, firmly into the doctor's hand. Next, the doctor calls out a cotton pellet. So cotton pellets are little tiny balls of cotton. I'm going to pick it up with my cotton pliers. And there's 2 ways to deliver this. Again, think about where the doctor will hold it. They hold it near the working end. So that leaves the back end of the instrument free for me to hold, or the very tip. So if I hold it with my right hand and I hold the tip, that leaves my left hand free to grab the old instrument. If I hold it with my left hand, I can still take the old instrument with my pinky, like so, and deliver it down into the doctor's hand. So again, for that one, let's put the explorer back. And I'll do it the other way. I'll hold it at the working end. I can take the old instrument and deliver this into the doctor's hand. And of course, the cotton pliers relies on pressure to hold it closed. If you notice, we lost the cotton ball. The goal of transferring the cotton pliers is to not drop what you're holding. If I had a real person, they'd be able to grip this. To take it away, if you're using your left hand, grab it away from the mouth. If you're using your right hand, grab it close to the mouth. The purpose of this, it would be very awkward if I tried to do this during delivery. You don't want to cross your arms in front of your body. That can lead to all sorts of issues, including dropping instruments, but think about muscle issues, work-related musculoskeletal issues. You don't want to cross your body, reach across for anything. We want to make it simple. So left hand away from the mouth, right hand will grab close to the mouth. So we're going to give the doctor their Explorer back. We're just going to set them up for the next transfer. Keep his thumb out of the way. So if the doctor wants a handpiece, here we have a high-speed handpiece. Now, the handpieces are set up on the doctor's side, but occasionally you might have a special handpiece, an electric handpiece for endo set up on your side. To deliver the handpiece, we have two choices, just like we had choices with the cotton pliers. If I hold it here at the working end, I can deliver it with my right hand. The doctor is going to need to grab it where it bends right here. So I cannot hold that area. I could also choose to deliver with my left hand. And I could take this instrument away with my right or using my pinky on the left. As a dental assistant, we usually don't have the luxury of a free hand. We're always holding something else in our hands. So I don't have the luxury of, going like this because I'm working in the patient's mouth, retracting or drying or suctioning. So we really have to do most of our transfers with a single hand. So I'm going to transfer like so. Left hand, deliver it firmly into the doctor's hand. And they would, of course, use that in the patient's mouth. To take away the handpiece, again, I could use my left hand to take it away at the coupling device, or I could use my right hand. Depends what hand is free and what I'm going to be delivering next. So I'm going to deliver a cleoid discoid carver next. So I'm going to do this transfer with my left hand. I'm going to take this with my pinky and deliver the new instrument into the doctor's hand. Now, there will come a time where we're transferring these smaller single-handed instruments back and forth to the doctor, depending on the procedure. And you'll be suctioning or drying or doing something else with your right hand. So we need to be able to deliver a new instrument to the doctor's hand and manipulate the old instrument to get it back into the doctor's hand. So just doing a single-handed instrument transfer. Take with your pinky, tuck it into the palm of your hand, and deliver the new instrument. So again, take, tuck, deliver, and we're still working on tooth number 8, so the working end is pointed up. So don't forget all those little rules, all those little guidelines to follow. Now, what I'm doing, what I did off camera, is I manipulated the instrument to get it back into the doctor's hand in the proper orientation. So I'm going to show you how to do that. That's going to be part of your skill for this course, is to manipulate this instrument in one hand. So of course we're using our left hand. Single-handed instrument transfer happens with your left hand. Take the old instrument, tuck it, deliver the new one. Now, to manipulate this instrument that we just took away, if I want to give the same end back, the cleoid end was in the patient's mouth, I'm going to put my thumb on top of the instrument to lay it against the palm of my hand. I'm going to wrap my fingers under the instrument and pop it up with my middle finger. So I'll do that a few times for demonstration. Take, tuck, deliver. Thumb on top, fingers under, pop it up. Always pop it up. Get back into a parallel position with the floor. Take, tuck, deliver. Thumb on top, fingers under, pop it up. Notice it is only my fingers moving. I'm not moving my wrist, my shoulder, my elbow. Thumb on top, wrap your fingers under, and pop it up. Now that's getting the same end back to the doctor. If they want the opposite end, so he's been working with the cleoid, if I want to give the discoid end, that one's a simple flip. Your thumb goes under, pinch it, and you give a half rotation. You might have to scoot or walk your fingers back down to the end. Take, tuck, deliver. Thumb under, pinch, half rotation. Take, tuck, deliver. Under, pinch, half a rotation. And then just walk your fingers back down. So if you're not left-handed, it's challenging at first. You just have to work your finger muscles. You just have to get used to the physical nature of this transfer. So for the skill, I'll call out opposite end or same end. If I want the opposite end, that's your flip. Opposite end, thumb under, pinch, flip. If I want the same end back, that's when your thumb goes on top, fingers under, and pop it up. So that's the most challenging part of instrument transfer, is if you're manipulating the instrument in a single hand. The last demonstration is with surgical instruments. Now, most doctors that I've worked with hold their hand above the patient's chest, and we swing these heavy surgical instruments up into the palm of their hand so they can grasp it. Because this is a two-handed transfer, I have to take away this instrument with my left hand. I take it away from the doctor with my left, and I swing a new instrument up into their hand with my right. These instruments are much heavier, they're larger, so we don't want to risk dropping them. So this is always a two-handed transfer. Always take it away with your left and swing a new one up with your right. And you want to have a very strong swing to it, so the doctor can feel it in the palm of their hand. You just want to give them a firm push when you insert this into the palm of their hand. So surgical instruments, take with your left, deliver with your right. You're always holding the working end because the doctor has to hold the handles. So always be mindful of what the doctor is holding, and that will let you know what's left over for you to hold on to. Firm transfers parallel to the floor. When we're doing these single handed instrument transfers. Tucking is important when you take the old instrument. It's always take, tuck, deliver. If I take and don't tuck, I'm likely to cross or get the instruments tangled up. So always take, tuck, then deliver to get the old instrument out of the way. So you take, tuck, and now you have a clear shot getting the new instrument into the doctor's hand. Practicing the manipulation you can do at home with pens or pencils. Remember, the doctor's not reaching for instruments. We don't want the doctor to have to reach for anything. So we can do this with pens or pencils at home. On the countertop, lay your pen or pencil. A little bit of it should be sticking over the edge of the counter. Countertop represents the doctor's hand, what they're holding. Take with your pinky, tuck, deliver a different pencil. Manipulate this pencil in your hand. You want to give the same end back. Thumb on top, fingers under, pop it up. Take, tuck, deliver. Thumb on top, fingers under, pop it up. If you want to do opposite end, that's your flip. And just scoot your fingers back down to the end. Take, tuck, deliver. Thumb under, pinch, half a spin. Take, tuck, deliver, twirl. So with practice, you'll get really good at this, even if you're not left-handed. So don't let that deter you. Your fingers might feel a little sore at first. You're using muscles that you're not used to using, but you will get used to it. It's part of your career. You're going to exercise your left hand a lot, and you'll be able to do it. So don't get discouraged at first. It takes practice, just like any other skill. Any sport, any instrument takes practice. So I hope that's been helpful with instrument transfer. And again, this is useful for when you come in to do your lab skills. Thank you for watching. Let me know if you have any questions.